All right, I'm here with Kim Dioramo. She is a physician, best-selling author of the MindBody Toolkit, and she's the founder of the American Institute of Mind-Body Medicine, who has assisted millions in self-healing from chronic disease. Kim, welcome to the show.
Thanks for having me here.
All right, I want to just dive right in with you because, you have a history being a former ER doctor who then found herself sick and was asking all these doctors, how do I get myself better? And nobody could answer it. But yet you found a way to heal yourself, which led you now onto your path of natural healing and healing so many others. So talk to us about that and kind of where you came from and what you're doing now.
Yeah, it was a very powerful journey of, like you and I had touched on before, we're focusing on pathology and disease and studying all the things that can go wrong in the body. And so for empathic people, I'm like a sponge, an energy sponge in my system. What you focus on expands. Just started exhibiting all kinds of pathology. And it wasn't just like this illness that I developed. It was like it started early on with we're in the GI system and I had like constipation, and we're in the cardiology system and I'm having palpitations. And it wasn't just that I thought I was having symptoms, but they found a heart murmur. Like there was real physiologic change. And so it was down my second year of medical school. I was very sick. I had severe joint pain every day, all day. I had chronic fatigue no one could figure out, chills and aches, like I was sick like a viral. And I'd gone to dozens of doctors and there were no answers. And then it was like, well, here's some antidepressant medicine because this must be in your head since I can't figure it out. And eventually ended up with a diagnosis of a severe autoimmune disease and being told, here's what you've got to do. And then like the cure was worse than the disease. I wouldn't be able to run anymore. I had to control my living environment. I had to take all kinds of medications. And it really wasn't until then that I realized what's up. I was like, wait a minute, something is happening in my body that's a reflection of something I'm doing. And I'd studied mind-body medicine for years and years and years, but I was trying to overcome it and trying to fight and trying to like, don't let this get me down. And it wasn't until I got that diagnosis that I finally really stopped looking and received and listened. And there was such a profound level of surrender. And that was really the day that changed everything. I got the insight. I was aware of what was happening and what I was doing inadvertently, and that relationship with my body that was creating all of that inflammation and sickness.
I love this. Okay. I know so many people that, just like you said, okay, maybe it is all in my head, but you went and saw a doctor and they even showed you, no, actually, Kim, it's not in your head. You have a heart murmur. And you're like, oh, see, I knew it. That must explain the palpitations. So what do you say to people though, when they come in and, but they're like, but Kim, you don't understand. Like, I've got evidence that I've got these disease. Like, what do you tell them to say? No, it's more than that.
Well, your thought process it creates your physiology. So it's going to create inflammation. It's going to create tissue changes. It's going to create tension in your body. It's going to alter the way your immune system is functioning, your liver and detoxification pathways, your gut microbiome. Like it governs absolutely everything in the physical. So you will see physical changes manifest.
Okay, so what was the back then? I mean, now what now is completely different. But back then, what was the self-talk? What was the conversation going on in your head? You got this epiphany, like, oh, this is all in my head. And you and I both know, like, okay, I can say that to myself. I have said that to myself. This is just all in my head. But it's one thing to say it and then to surrender and understand it. That's a different level. So how did you go from there to kind of where you're at now and helping others?
I saw that it had all been fear. What's wrong with me? What's wrong with me? What's wrong with me? And then it was like mind over body. I was trying to like get above it, or I'm not going to let this get me down. But it was still a thing. I don't want to defeat me, right? So you're feeding both sides of the equation. And I was in this fight and really like a fear, so I don't become a failure. So it's like a race against that, whatever thing I thought was in there. I'm a failure, or I've got to overcome my own inadequacy. And so it was that day when I finally listened, I saw that, but it was a surrender. Like, all right, body, what do you have for me? I wasn't looking for the answer. I wasn't trying to get somewhere. I wasn't on my own agenda. I just let go. So now, instead of coming from fear, I actually saw what was actually in here all along. And it was in that surrender, what you see, what you witness, you're healing. So it was like becoming aware of it, but also releasing it all at the same time.
Wow. Okay, so then at that moment, you had this amazing epiphany, this transformation within yourself. And then did that lead you then to kind of leave the emergency medicine that you were doing to where you're at now with MindBody?
So I had always gone into medicine with the vision of bringing this deeper truth into, this field of how we're seeing the body. I'd seen at a very young age through an awakening experience. Mind and body are connected. The body can heal itself. Our thoughts are creative. We are not separate physical beings. We are pure energy. So that was really my inspiration for going to be a doctor to begin with. And I did then heal my body and have like, whoa, this is way more powerful than what I thought. And we can access this power. We don't have to figure it out or try hard or get better at something. Like that actually just made me more sick. So it was like a real time learning of everything I'd studied in mind body medicine. But it was like, oh my God, the application is nothing as simple and effortless as I had thought. So I did continue my medical education. I went on to do my residency in emergency medicine. And Joel, the reason I did that was that is a great way that we're practicing Western medicine. You can get yourself sewn back up. You can start the heart back up. Like for the acute thing, it is a very wise way to practice. So I did not want to learn internal medicine. Let me keep pushing your pills and, you're not going to die today, but you still have diabetes, and just kind of pushing people along with the same illness. But I was really interested in emergency medicine. Like, all right, I can do that and then finish my training and go to my next step. So, I went on through that. After this experience, was a way more grounded person, because now I'm not in a fight with my body. I'm surrendered to my body. Like I don't have to fear what I am. It's not this, you're a failure, but if you overcome it, maybe you'll make it. It was like, oh my God, it's a delusion that I could ever be a failure. It's a delusion, superiority, inferiority, I'm inadequate. Like, so that didn't own me anymore. And magically went through the rest of my training, like opportunities opened up. I was always resourced in like really interesting ways. And then it was a couple years after practicing full-time ER, I was like, all right, where's my life? Like, certainly this is not where you're going to leave me. And I didn't know how to like make that next step happen. But I just kept staying open, and my journey brought me to like unbelievable experiences and opportunities, and finally to establishing my own osteopathic medicine clinic to help people heal. And what that led me to was really teaching what I'm teaching now, which is that your illness, the physical, is governed by the inner thoughts and the emotion and your inner relationship with yourself, and that you can shift your consciousness to shift your health.
Okay, that sounds great. That's a great speech, Kim, as some people would say, but people got to come to you and they've got to say, but Kim, you don't understand. I have MS. I have Hashimoto's. Like, this is a legit disease. Look at my labs, Kim. And what do you say? Do you say, oh, but come on, like that's just all made up in your mind? How do we, right? So how do we tell people, or how does what you do kind of integrate with maybe a Western doc who can say, or actually, I don't want to say Western doc, because let's face it, no Western doc is going to heal anybody from Hashimoto's or MS. I already know. There's functional people out there that will do it. So how do you kind of do, though? Functional people might do detox protocols. How are what you do with the energy and some of the other things you do, the mind body, how does that integrate with someone like that?
So your cells are listening. And when you see someone with a Hashimoto's or an MS, multiple sclerosis or a chronic fatigue syndrome, and you say, oh, this is going to keep getting worse, and here's how it's going to go. It's progressive. You're always going to have this, and you'll need medication. Your thyroid doesn't work. You need medication for the rest of your life. That is 100% true as long as you stay in that same consciousness that's creating that suppression, that illness, and that physiology. It's 100% true. And that's why if your doctor tells you, yeah, you're going to have this for life, well, on one level, he's right. She's right. But if you were to shift your consciousness, even actually 2%, doesn't mean it has to be this dramatic, I'm not the same person anymore. It could be subtle shifts, but they have a very, very profound physiologic consequence.
And I totally believe that. I think your body has this innate intelligence and knows how to heal. It just needs to be given the right input. So with what you do at Mind Body Medicine, can you kind of tell folks, I mean, I don't even know what you do in terms, what would people call you? Like, oh, you're an energy healer, you're this. I have no idea. How do you kind of think of yourself and maybe some of the modalities or the things that you will bring to a client if they come to see you?
Yeah, I share that I'm a mind body medicine doctor and that I help people shift their consciousness to shift their physiology and their health and also shift what's happening in your life. And so it's just governed by this understanding that we're not primarily physical. So if you think you're just physical, then yeah, your thyroid's broken. It's never going to be otherwise. But if you remember, your thyroid cells could regenerate. Every single cell in your body is regenerating, and it could regenerate to a healthier level. And that depends on where you're functioning from, who you're being. We see patients with multiple personality, and like this personality is brittle diabetes, not making insulin. The pancreas is not working. And they shift over here to this personality and they have no diabetes at all. The pancreas is working just absolutely fine. And that's in one body. So you realize like, okay, the functioning system of who I think I am, what I believe is true, the history I'm carrying with me in each moment is actually a program telling the cells how to behave and how to recreate and, create and recreate themselves. So you can, and you are changing your body. It's just, you're usually changing it to match the same template over and over versus like a 2% shift to match a higher template of who you really are.
Okay. I've got a great question for you. So my wife sometimes will say to me, Joel, I'm feeling sick. And I look at her, I go, you're not sick, you're in perfect health. And she goes, yeah, right. Rolls her eyes and says, Joel, don't give me your like mumbo jumbo subconscious stuff. And I'm like, okay, what do you say again? And
So
give me some advice, Kim. What do I say to my wife and all the guys that are listening, or other wives do the same thing? I know to their husbands, and the husbands just roll their eyes and they're like, yeah, that positive stuff doesn't matter. Talk to me
It's
about that.
true.
Yeah.
It's true. The positive stuff is bullshit. And I don't mean you're not 100% right with what you're saying to your wife. But when we are using it to cover up what's ready to be seen, we're not really helping ourselves out. And this is why I stayed sick as long as I did. Wasn't a day, it was like a year and a half, even though I had known this stuff. I was trying to be positive and get above the illness and override. But what's happening with illness is something that's ready to be seen. So if we actually let it be as it is, how it is expressing itself, like stay here as long as you want, that energy will move very quickly. So in that moment, I feel sick, and I do this with myself all the time, right? Okay, what are you actually feeling? So it could be like, oh, I have chills, I'm congested. Oh, my neck, that's what used to happen. But I'll meet what's under that. What do you need? Because until we receive what we need, we can't let go of the symptoms. The symptoms are just a placeholder for us to ask for what we need. So if we can soften, I feel so sick. And then there's like, oh, and I'm afraid I'll get worse. I feel sick and oh, I feel hopeless that I'll be able to do anything. I know for me, when urgency used to run me a little bit more, it'd be like, oh no, if I'm sick, then this will happen. Or if I slow down, I have no worth and value, right? It's all this other shit that's ready to get seen. And I can't just put ice cream on top of poop and go, you're not sick. You're just be positive. It's like, F that. Now you're ignoring the whole universe within you that's ready to be seen, because through that quote sickness, it's actually a journey. It's a transition. It's a shift. There's something more powerful in me that's ready to emerge, that unlike the conditional, like, oh, I'm sick, but if I overpower it and positive my way through it, I'll be better. It's like, no, I am the power. I could be sick. I could be not sick. So once the fear is no longer there, I could be sick, I could be not sick. Once the unworthiness is no longer there, we really are at pure choice. It's what you resist that persists. If I'm no longer in resistance to the sickness and like the fear and the unworthiness and the guilt that may go along with it, then it can dissolve. And that's a very, very different place.
Okay, you nailed it. Thank you so much. You're helping me and so many other people with that one. So now I have a better understanding of how to relate and how to just express that. Because even my kids,
Especially as a parent, I know you have kids too.
yeah,
Like try that with your kids, right? They're
yeah.
just going to cry more. No, don't cry. It's like, oh, come here, sweetheart. What do you need? And if you do it from your fearless, grounded, true self masculine, you're going to hold space for your wife and your kids. Like you can be as sick as you are right now, and I'm here for you. What do you
Mm.
have? And you'll find they'll release something. And then it's like, oh, I feel better now.
I love that. Okay. That is super, super powerful. Anybody, I don't care what the rest of the episode we talk about, that was gold. I want to go back though briefly about thyroid, because we were talking about a lot of the thyroid and other issues, and we mentioned MS. Just in your experience, and I know you've worked with thousands of people, have you seen something like thyroid, again, disease, which I don't even believe in that, but let's just call it that, disease. Have you seen it reverse pretty quickly with just someone coming to see you, or even MS? Do you have any like testimonials or anything that just stands out where you're like, oh yeah, like so-and-so came in and in
Oh,
4
yeah.
treatments was better?
Yes, I had a woman with severe thyroid disease, and the reason this is a great story is because there was a nodule, and they found it on the ultrasound. And so there are also these physical findings and lab findings, and like a whole slew of symptoms. And when we did the work, right, get underneath what is the illness, there was so much fear, like I can't stop, I gotta keep going. It's very common with thyroid because really it's the adrenals overrunning, and then the thyroid's like, I can't do it anymore. And then it looks like it's thyroid disease, but it's really something happening overrunning the adrenals. So we did this deeper work to basically same thing, like releasing unworthiness and guilt and fear. And like there was a lot of anger with her mother and some body issues of like, she just was afraid of putting on weight. So she's running and running. And there was a real fear of being out of control in her body. So these are all like the inner masculine, inner feminine balance. She released that. We did also a lot of work with her mother. Not actually like her physical mother came in the room, but her relationship, because you carry it within your cells. The whole thing is right here. And we released that, and it was within weeks. There's no more thyroid nodule. Her thyroid function completely returned and repleted. She started running again. She was fit. Her energy came back. So, they had rechecked the ultrasound, and, there's no nodule. The labs and her labs were normal. So it's great to see the physical response. But people will instantly feel the electromagnetic frequency shift. That is instantaneous. And then the physical body follows.
Very cool. And typically when people come to meet with you, what are sessions can they be? I'm assuming this can be done all virtually all over the world. And then is it like hour appointments, and when do people, and again, there's this bio individuality, right? But in general, like how often, if someone has thyroid disease, for example, how often will they come see you where they're like, man, I'm feeling great, I don't need to see you anymore?
Yeah, it's a matter of the time you're giving your body to regenerate, which for everyone is different. How much personal power have you cultivated to allow that shift to happen? So the way I've done my work now is online, that they'll download the exercises, the videos, the teachings, and go through that and do the work on themselves, and then let themselves integrate. And they can ask questions in the MindBody community we have in Facebook. So there's, some way people can get questions answered. Some people work with me personally, where we have this year-long program called Embracing Health, and we'll guide them through this over a year's journey. Most people in the first couple of months will have major changes. But you're integrating a new way of being with your body, with your cells, with your experience of like illness or symptoms. And it's really a new way of being with the moment. Am I showing up to this moment in fight? Am I showing up to this moment receptive? One is going to create all kinds of disease. You could just label them all. And one is going to create just dynamic health and well-being. So I've seen all kinds of different timelines for people. Sometimes immediately they will feel a massive shift. And then the body can regenerate. With MS, I had a woman, it was months. She went from being in a wheelchair, not walking, not able to get around, and it was deteriorating and declining very quickly, to within months, she's walking around and beginning to move. She didn't have the wheelchair anymore.
Wow.
And her symptoms, were resolving. So it's different for everyone. But I've seen that the things that underlie this stuff are kind of universal, whether it's like chronic Lyme disease or cancer, or sometimes it's like, I don't even know the name of my disease because they think they made it up. But the energies that underlie them are often very common that we all have.
Yeah. I was just thinking too, as you're talking, childhood trauma, childhood wounds, we know that there's a lot of good neuroscience suggesting from 0 to 7, that's kind of when like your personality, like who you are, and like some of the beliefs that you take on into adulthood and express is kind of governed during that time period. And I got to imagine like a lot of that is affected. Do you see that a lot in your work?
Yeah, almost 100%. I would say 100% with people with chronic illnesses not getting better. There are universally, and it's not always like, yeah, well, I did have this big trauma at 4. Almost always they're like, no, I mean, it's pretty normal stuff. But when you go back, I would just say, like, to a sensitive being raised in a society where we're told our power is outside of us and we're told our success is conditional, that is extremely traumatic. Like, we're not taught the truth. You are a beautiful, divine being. You're so precious. You're so powerful. You can create everything. Let's nurture you so that you operate in your genius of whatever your gifts and talents are. No, it's like, here, can you fit into this system? Oh, you don't quite fit in. Let's medicate you. Let's force you. Let's make sure you get better at this because you got to do this. And if you make it through, then someday you're going to be all set. But it's like, well, this sucks. It sucks going through that system of like our educational system of like being a cookie cutter. Like, everything about it sucks. And then you're the problem because you didn't fit that, or like it wasn't fun for you. We're in a very contrived societal system. And so a lot of the stuff that's happening, you don't recognize it till later, but it's enough to have you suppress your life force essence and never know who you are, and then come out into adulthood like, no, I can pull this off, and not realizing you're accessing like 2% of your energy.
I think that's really key, because I could see so many people, and including yourself, using you as an example here, late 20s, and let's even say most people don't experience illness, chronic illness, typically till they're like 30 or 40. And then it's like, well, that just happened over time, but it could have been building up. You don't see it, even though it happened, like you said, at 4 years old. So I think that's really key what you're saying, and people should understand that and give themselves some grace, because just because it showed up when you're 40 doesn't mean it didn't relate to this root cause childhood issue, right?
Yeah. And it's linked into, you're carrying it now. You're carrying, let me be a good girl, or let me be a tough man. I'm going to handle your problem. And that's great. Like, you're naturally a caretaker, a provider, a go-getter. But then if this part of you hijacks that, now you're using that as like a survival mechanism, trying to max out on this strength and like make it everything that you are. Well, now your system doesn't maybe shut down or allow for repletion in a way that would be your nature. So we're not in our nature. And then we're like trying to maximize these things that could be strengths, but we're overshooting because we're living in fear and disconnection.
Yeah, so good. I'm just, as you're talking, I'm thinking, do you work with a lot of like just entrepreneurs and go-getters like that don't have disease? Because I don't have any disease, but as you're saying some of these, and I'm like, oh yeah, I'm nodding my head. I'm like, I could totally relate to that. I don't have an expression of a disease, but some of the
Yes.
the
Yeah.
mental
I have
blocks, right?
a program, the other way I work with people live, it's called Be the Medicine. And it's about how like we'll find this big vision and a big yes. And then, through our own maybe journey with challenges or illness or whatever. And it's like, whoa, I want to share this with the world. But then people will start to engage those business practices, and it short circuits them. And they're like, I get, fatigued or burnout, or my Hashimoto's came back, and what's going on? So they think, let me back off from the business. But it's really about, let me engage in this more from my true self and less from that compensatory pattern. Your power is like astronomically more, your impact, your synchronicities will be like through the roof of right place, right time, right person. And then your energy, because you're no longer trying to use your like small self power to power your way through, you're resourced. So it's source power that comes through and does
Mm,
your work for you.
I love that. Okay. I might have to sign up. Okay. Be the medicine. I love that. Talk about just some of the other, energy kind of healing modalities. I know like one of the things you do is tapping. So talk about kind of, I think anybody that's like listening to, or has maybe seen tapping, it's like, yeah, that's a bunch of woo woo stuff, like tap here, tap here, tap there, and now I'm healed. But talk about maybe some of the science behind that, why it works, and just maybe some of the other modalities you use.
Yeah, so EFT tapping, when I learned it, because I understood the energy system so well, I could see energy, I could see when people's energy was stuck. This sort of third nervous system, which is the meridian system, is sort of like completely left out of the Western model. So people don't necessarily understand it. So you've got your voluntary nervous system. I'm going to lift weights. I'm going to, move the thing. You're intending and controlling that. Then there's the involuntary, which is my heart is pumping and my body's breathing even when I'm asleep, and blood pressure is being adjusted, food is being digested. You don't have to think about that, but it's happening. And then the third nervous system is the meridian system. And that's how I think of it. And these are the energy currents. Like you're basically a giant battery. And all of these energy currents are transmitting energy, detoxifying energy, rejuvenating your body and repleting your energy. And so you got to think about like minerals and salts and your giant battery. How do you replete that? For a lot of entrepreneurs, we move a lot of energy. So if you get depleted, it's like conked out. If you're on, you're just like unstoppable. And you've got to learn to work with that third nervous system. And tapping is like a super easy, genius way to do that. So you're clearing out those pathways. And when you do it with the words, we'll do some tapping here, you're clearing it out along the specific frequency of that thing. Like, oh God, I'll never make it. Or oh, I have to make sure I help my family. And whatever the fear is, whatever the belief is, it carries a frequency and consciousness. And so just like, if you've got a smooth piece of silk, oh, this is so soothing. But if you got something really gritty, you need sandpaper. So you need like a good grit to kind of like match the frequency of what you're resolving. So when I do tapping, people will say, aren't you affirming the negative thing? Like, I'm so worried about my finances. Yeah, it's not an affirmation. It actually works because you're acknowledging that fear. You're already thinking it anyway, but now you're acknowledging it with compassion and with power. Your presence is power. So it helps clear it from your system so it doesn't have that power in your system anymore.
Yeah, it almost just reminds me of what you were saying earlier if like one of my family members was sick, I'm kind of affirming it. You would almost say, yeah, that's negative, but we're kind of labeling it. We're welcoming it. Really, we're accepting it in this different way. And then you're using the tapping, I guess, to kind of disrupt the interference, if you will, it sounds like.
Yes, yes. And let the energy move. So if your body knows how to clear it, knows how to release it, we're going to let the body do that. And we could do a little tapping.
Yeah, let's do one.
Do a little, why not?
Yeah, yeah.
So you could start with, and why don't we just play along with it, that you bring up something you've been dealing with that you're ready to clear. And then I'll guide you through how we do that. And maybe something that is gonna, I think either way, it's gonna be something people can relate to.
Yeah, let's do fear of my business not being successful.
Great. Okay. So I want you to first feel everything that brings up. And for people doing this, you could write down everything that brings up, like my family, or what will my parents think, or whatever it means to you. So fear of my business not being successful. And now feel on a scale of 1 to 10, how grippy is that? Like 10 out of 10 is like, oh my God, this is always there. It's a big trigger and it's very intense. And that's what you want to tap on, is something, at least an 8 out of 10.
Yeah, I would say 8. Yeah, it depending on the
Awesome.
day, could be an 8 or 10. 8 through
Good.
10. Yeah.
And then you want to look at like what comes up with that. Is there a circumstance you're worried about? Is there a person? Is there a thought or an idea? Is there a past history of one time when this thing happened?
Yeah. I would say, and I think probably just childhood belief. I'm maybe like, I'm not good enough. I'm not good enough. And I've never done it before.
Yeah. Okay, great. We're going to start with that. So we'll do some rounds and then we'll check in again. And so it's really helpful to get that gauge of, okay, this is an 8 out of 10 because we're going to watch what happens as we go. So outer edge of your hand, you could do one side, you could do both together. Doesn't really matter. You're just giving it some stimulation. And then you're going to repeat after me out loud. Even though I'm really worried about my business not working out,
Even though I'm really worried about my business not working out,
I choose to open and allow something higher.
I choose to open and allow something higher.
Even though there's fear and worry about my business.
Even though there's fear and worry about my business.
And how is it going to go?
And how is it going to go?
I choose to be at peace now.
I choose to be at peace now.
Even though I can't control everything.
Even though I can't control everything.
And there's a lot of factors involved.
And there's a lot of factors involved.
And other people.
And other people.
I choose to release that and allow strength.
I choose to release that and allow strength.
Okay, so that's our 3 setup phrases. Now we go to the inner eye point right on this bony ridge, inner eyebrow. All this fear I've carried.
All this fear I've carried.
Good. Outer eyebrow. And I'm worried deep down.
And I'm worried deep down.
Under the eye. I'm responsible for other people.
I'm responsible for other people.
Under the nose. And this is really heavy.
And this is really heavy.
On the chin. This old perspective about doing business.
This old perspective about doing business.
Under the collarbone. I'm vulnerable.
I'm vulnerable.
It's risky.
It's risky.
I'm not in control.
I'm not in control.
Under the arm. The idea I have to be in control.
The idea that I have to be in control.
That's it. Good. Top of the head. And that it's up to me to make things work out.
And that it's up to me to make things work out.
Inner eye. This is just an idea.
This is just an idea.
Outer eye. It's not what's actually true.
It's not what's actually true.
Under the eye. My mind thinks it's totally true.
My mind thinks it's totally true.
Under the nose. I have to get my shit together.
I have to get my shit together.
On the chin. I can't just slack off.
I can't just slack off.
Under the collarbone. I have to make sure.
I have to make sure.
Things work out.
Things work out.
This is exhausting.
This is exhausting.
Under the arm. It's really heavy to do it this way.
It's really heavy to do it this way.
Top of the head. The pressure I put on myself.
The pressure that I put on myself.
Okay, take a big breath in, relax your shoulders. And then let it all go. We're going to do a little bit more, but in this check-in, what's your number? It might go up, it might go down, it might stay the same. And we're going to talk about all 3 of those. So where is your number?
I would say it's dissipated a little bit. It feels like the energy's kind of moved, maybe like a 6.
Okay. And what that I said may have resonated, if anything.
I've got to get my shit together. This is exhausting. I think you said something about exhausting. That was a good one. I think everyone depends on me. That was another one.
Yep. Okay.
Yeah.
We're going to move right into this and talk about it in a minute. So inner eye, this idea, I have to get my shit together.
This idea that I have to get my shit together.
This came right from my dad.
This came right from my dad.
Outer eye. He was trying to teach me what he thought was best.
He was trying to teach me what he thought was best.
In the world he lived in.
In the world that he lived in.
Under the eye. This is not your world, Dad.
This is not your world, Dad.
Under the nose. What if this is not true for me?
What if this is not true for me?
On the chin. What if in my world?
What if in my world?
The more I let go.
The more I let go.
The more I contribute.
The more I contribute.
under the collarbone. What if in my world,
What if in my world,
the more I surrender,
the more I surrender,
the more I receive?
the more I receive?
Under the arm. What if in my world,
What if in my world,
the more I let go and trust,
the more I let go and trust,
the more I already win?
the more I already win?
Top of the head. What if I allow my truth
What if I allow my truth
and release my dad's?
and release my dad's?
We're going to do a little more inner eye. It's exhausting.
It's exhausting.
Outer eye. What if I allow
What if I allow
myself to be nourished?
myself to be nourished?
Under the eye, not just a giver,
Not just a giver,
under the nose, but a really good receiver.
but a really good receiver.
On the chin. When I receive, everyone wins.
When I receive, everyone wins.
Under the collarbone. When I'm nurtured, we all benefit.
When I'm nurtured, we all benefit.
Under the arm. What if I have a new relationship with nurture?
What if I have a new relationship with nurture?
Top of the head. And allow myself to receive deeply.
And allow myself to receive deeply.
Deep breath. Oh my gosh, that was really good. Exhale it all, let it go. Okay, so just notice what you feel. Tapping really just suspends the disbelief. It allows the programs to be neutralized so I can let in new information and new awareness.
I'm supposed to say that?
No, I'm just
Okay.
telling you.
Okay. I was like, that's a tough one to remember.
It's a big one. How do you feel?
I feel good. I feel light. Yeah, I just feel like light. That's kind of like a lot of lightness.
And where does it feel now? I'm worried my business won't work out.
Like a 3.
Good.
Yeah.
So this is good. Even just something as simple as that, if you, in your morning, meet whatever's there and tap yourself down to a 3 and, or just tap even just to be where you are. Don't even try to get to a 3. You will function from a different place all throughout your day. That will inevitably create more wealth. And wealth is health. They're exactly the same frequency.
Yeah. And so people could do something like that where you walk them through. That could be like their daily. I think it's kind of like, you say if you do that daily, it's almost like meditation or something. And the more you start to do that in your experience, the more you start to kind of wash away these emotions and these things that are limiting you. I'm guessing that you just vibrate at a different level. And then that's when synchronicity and all these things start to happen, because your vibration, you keep shedding that crap that you don't need on you, and your vibration starts to manifest new things, new health, new wealth, everything, right?
Yes, it's actually been quantified. The HeartMath Institute has looked at your electromagnetic field in this emotion or this emotion. And a lot of the emotions we carry are subconscious, but they are directly affecting our outcomes.
Yeah. Okay. Really, really cool. Thanks for doing that for me. And thanks. I think anybody watching or listening, what a neat tool that you can start to just add to your toolkit or go see Kim and do more of it. I wanted to talk to you briefly. You have this thing called the instant elevation technique. What is that? And like, what makes this thing so special?
So when I was very young and energy sensitive, I would do these energy clearing techniques. I didn't even know I was doing them. I just never occurred to me that other people didn't do this. And I could open my third eye. I could bring energy through my heart. I could clear my energy field. And it wasn't until years later, when people asked me, what are you doing? How do you do that? That I broke it down into a 3-step process. How do we cultivate our power? Because if our power is creating, like, it's either going to create that the authorities have control over me. I have a lot of doctors who have said, well, I can't do this because I'll get in trouble, or I'm not allowed. And you're like, who are you giving your power to? So you gotta get your power back, and then your energy is creating in your body. So how are you breathing? How are you moving? How is your physiology being conducted? And then your conscious choice. So it's a 3-step process of awareness, breathing, conscious choice. And I created a whole program to work with you to get your energy back. And like, what does that even mean? How do I do that? Shift your breathing, because that shifts your brainwave frequency and all of your physiology. And then C, which is conscious choice. And the crazy thing is, all the biohackers and like a lot of entrepreneurs, it's all C. Let me get more conscious. Let me do this. Let me take the supplement. Let me do EFT. Like, that's the sexy stuff, but that's like nothing. That's like the tip of the iceberg. If all you do is get your energy back, like right here, right now, and we'll do a little mini practice for that right now,
Yeah.
and shift your breathing, you are already winning the game. You're already in your power and in a powerful physiology. People will feel you. They'll feel your electromagnetic field. All your choices will be very different. And of course, your outcomes will be different. And then you may not even need the supplements or the biohacking or the like, all of that, because the whole game is really about where is your energy.
Yeah. So true.
Okay.
I mean, I
So
love that you're saying this, because I've been doing more and more breathing myself, just like towards the end of the day, right before I kind of leave work and go to my family. I just noticed my mood might be like off, just kind of fatigued, And so I've been doing a lot of resonance breathing and a lot of just Wim Hof, because it just physiologically changed me, and I just feel so much better. And then I like, okay, now I can go back into them and be present. So this is awesome.
yeah, so your system, it was like mine was for a long time. You put a lot of energy out, and there's like an eagerness and excitement, enthusiasm. But then my energy was like always like a few feet out in front of my body, and my body can get depleted or sick or whatever really easily. So I had to first learn to bring my energy back in.
Mm.
So if you just relax your body and like kind of see your energy out there in front of you, and just bring it right back right here right now into your body, like you could see that panel just coming here closer, 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 and then bring it right into your body right here right now. It's not out in front of me on to the next thing. It's here right now, where it's active in my body. Your physical body is a powerful technology that is emanating an electromagnetic field. And when you bring your attention and presence here now, it activates your system. So that will be one way for you to just every day, like, pull your energy back in.
Mm.
Hey, Joel, let's be right here, right now. It's okay. And let it connect in your body. So that's like your first step, is just breathe it right back in and soften your body. And then the second one, you could put your hand on your heart. It's very simple. Just say, hi, body, how are you? And you could say it out loud. Hey, body, how are you?
Hey, body, how are you?
All right. And now I want you to feel your moment now. Your body only lives in the now. It's right here. It is your point of access to all the power in the universe. And if you can just get yourself here, your presence, you will access all the power in the universe. So feel your body, what's here right now. It may be a shakiness, it may be a peace, it may be butterflies in the stomach. It may be, for me, a lot was a shaky, like urgency pressure in the chest that bumped me out of my body. So stay here for what's here and just feel it, and say one more time, hey, body, how are you? But receptive.
Hey, body, how are you?
Okay, now in that question, cultivate the curiosity of the receptivity. Like, this is a system. So I don't own it. It's actually a system I'm observing, and it's going to show me something. So bring my energy back. And hey, body, how are you? Is actually like a check-in, like a curiosity. What do you have for me? Here I am. What do you have for me? Like a loving parent, not a let me manage you, fix you, manipulate you, take care of you. I'm just going to receive you. And so feel in this moment what you feel, and you can share anything you notice.
You know what? For me, it was just peace, relaxation. Honestly, I just felt a sense of gratitude. I just kind of felt like
Okay, good.
asking my body that made me feel like I got so much stuff to do today, but I just kind of had this feeling of like, oh my God, like I could feel my heartbeat and just feeling alive. And because I don't do this often, what we're doing, that check in and just asking my body and like feeling it, like, because I think as guys too, we don't do a lot of feeling, right? We try
Yeah.
not to feel. We try to tap
Yes.
out. I don't need to feel. And so just asking that, I was like, like, how are you? How are you doing, flesh suit? And I kind of felt like the
This is
answer
big.
was just, yeah, it was just like, I'm here. Body's like, I'm
Good.
here. And um, I mean, I felt maybe a little bit of stress too. Like, we're working hard for you, Joel. But then I found out I had this like, just kind of like, like piece of just, yeah, my body it's doing a lot for me and I don't even recognize it.
Yes, yes, yes. Okay, so that's like the self-abandonment little tactic we do where it's like, I'm up there, I'm going to do this, I'm on to the next thing, I got to take care of everyone else, and then neglect. And that allows the programs of, like you said, like the I'm not good enough, or who knows what's in the system, it's a collective thing, to just run rampant. And so the hey body, how are you, is I'm here. Now, I'm just going to take you a little deeper into this. If you breathe in, hey body, how are you? And now cultivate the equanimity of, I'm going nowhere. So the body might be like, not okay. Or the body's like, I don't know what to do. I don't have time for this. We got to do the thing. And you're like, I'm going nowhere. I am right here. And you can say out loud, I am right here.
I am right here.
I will be here for you.
I will be here for you.
And now just take 10 seconds to feel and presence what's come up, because this will be a point where emotions will release, energies will release. In the space of your presence, you'll be amazed what discharges out of the physiology of the physical body. It'll literally discharge. It could be from 3 years old, held in there for decades, and it can discharge in one moment of, I'm here. Okay, now I want you to feel, what if I show up this way in my business? Then there's clarity of like, yes, do this thing. Oh, let that go. What if I show up this way for my wife?
Hmm.
And just witness for a moment her physiology. She's held. I've got you. I am right here. Okay, say out loud, because I'm here in me, I can be here for you.
Because I'm here for me, I can be here for you right now.
Good. So feel that with your wife. And then I want you to feel it with your business, and just see the business and everything it has to offer that it's going to create, and say, because I'm here in me, I can be here for you.
Because I'm here in me, I can be there for you.
Because I'm here in me,
Because I'm here in me,
I can be here for you.
I can be here for you.
Good enough. Feel how present you can be to your business. That if your business, like, yeah, no, that system's not working. Oh, let's hire this person. Oh, let's do this. Like, it could move you in a way that you weren't necessarily as available to before. Good. So just breathe and feel that. All of our emotions, or even an illness or whatever, is actually just calling us to show up to deeper presence and show up for deeper power. Thank you for playing along. It was beautiful.
Yeah. Wow. That was good.
Yeah. When we
Just
can be a
super
better
light. I mean,
listener.
it just,
Yeah.
I mean, and presence is something I've been working on a lot. And what a great kind of tool for instant presence and just kind of bringing it back. I mean, I felt a little energy moving around, and I felt just like when you dropped me down into that presence, I felt like I was kind of smiling. I'm like, nothing can go wrong right now. Like, there's nothing. Like, there's nothing. Like, everything is good.
It's powerful that when you drop deeper, you are in a higher frequency. Sometimes when we drop deeper, what comes up is the fear, and what comes up is, and so we think, I'm doing it wrong. It's not. A person dropped in is exponentially higher frequency and more safe than a person disconnected, even though you might feel better if you're disconnected. When you're present, you'll move it. So this is really beautiful.
Yeah. Kim, this was so cool. This was so fun. I know we're probably running a little bit long. I probably got to have you back for a second one, because I feel like I could ask you so much more. But let's wrap things up, and we'll bring you back for another one, because this was a lot of fun. But just before we do, just anything else that we didn't touch on that you don't want to mention, or just any exciting projects that you're working on right now you want to tell the listeners?
Yes. So we have been sharing more about how your consciousness affects your physiology, how your consciousness affects your business. And my interest is for those who are part of those new systems. You know, new structures are getting created for like a true healthcare system instead of a disease care system. And so people are feeling that inspiration from the inside out. And like your old job is going to be like, I can't even tolerate this anymore. But it will feel like, what's wrong with me? It's actually the new thing calling you forward. So really trust what's in the heart. You can tap on the heart. You can do the practices we shared here. And I share a broadcast every week called MindBody TV. It's on my YouTube channel, Dr. Kim Duramo, and it's in the MindBody community in Facebook. So people can join us there. And yeah, each year we run the Be the Medicine course for people who are ready to move into higher systems of business and contribution and power.
Yeah.
So that is something I'm really, really excited about. So I'm at drkimd.com for people to stay connected and stay tuned for what we're doing.
Very, very cool. I'm excited. I'm definitely gonna have to sign up for that. Last but not least, just kind of tell everybody where they can find you, learn more about you. Obviously, you left your website, but just on social,
Yeah.
there's some other channels that you're at too.
I
And maybe
will.
mention
I
your
want to
book
share
and
the book too.
all that other good stuff.
I wrote the MindBody toolkit. So this is 10 tools you can use anytime, anywhere to shift your frequency. And they're easy things you could do, like at a red light in the car. How am I being in my body? But that will allow new neural pathways. It's, you know, your brain is neuroplastic. You are changing who you are. And these are like really easy ways to move into that direction. I'm on, Facebook, as I mentioned, and Dr. Kim D is the website. And we're also on Instagram. I do some clips and videos in there so people can stay connected with me there.
Amazing. Kim Dioramo, thank you so much for being on the show. We appreciate you.
Thank you so much, love. It was so great to work with you.